Welcome to Facing the Future, brought to you by the Concord Coalition on WKXL, New Hampshire's talk radio station. I'm your host, Bob Bixby. Each week, we take a nonpartisan dive into topics related to the federal budget, the economy, and how it all affects our nation's future. This week, Dr. Kent Smetters, faculty director of the Penn-Wharton Budget Model at the Wharton School, University of Pennsylvania, is here to discuss a new report on the potential economic and budgetary impact of generative AI. And I am not a bot. I am real coming to you today, and so is Ken Smetters.
For now. For
Yeah,
now.
that's right. For now, but anyway, but we're going to look at that report. We're also going to look at an illustrative package of tax and spending reforms released by the Penn-Wharton Budget Model that put together could reduce future budget deficits, grow the economy, reduce old age poverty, reduce health insurance premiums, and even reduce carbon emissions, among other things. So that's a pretty promising agenda, Kent. Welcome back to Facing the Future.
It's great to be back with you, Bob.
Well, as the name of the show implies, we like to focus on the future, and there's no doubt that the future is going to be shaped in part by artificial intelligence. We have chatbots and we have self-driving vehicles, which I haven't tried yet. So AI is certainly changing our daily life, but what you were looking at is how is it going to affect the economy and
Right.
jobs and wages and even the federal budget. So you put together this report last week. I thought there were a lot of interesting building blocks on the way to your ultimate conclusions. And so I just wanted to begin with, how much of the economy are we looking at that could be exposed to HI?
Yeah, so AI is going to have no question have an impact. But it's going to differ a lot by sector. So like a lot of office administrative support, occupations, business, financial operations, and so forth. We think they're going to be greatly exposed to AI. Up to three-quarters of that their work is going to be replaceable essentially by AI. And so what we've done is classified it into different categories based also on literature that's been done and the various good studies and so forth. And right now, what we're estimating is over time, roughly about 45-ish% of the economy will have 50% or more exposure to AI. So, let's call it 40% of the economy, because a little less than 45% will have exposure of at least 50% of the tasks currently being done in that area could be replaceable by AI. That sounds like a lot, for sure, but that doesn't mean that 40% of all wages being paid are going to be replaced by AI. It just means of the literal jobs. And a lot of times these are jobs that are sometimes higher paid jobs like computer or math occupations, where estimate about 63% of those tasks can be replaced by AI, whereas building and grounds and cleaning maintenance operations, that's like the lowest, 2.6% that can be replaced by AI. So it's not proportional to wages, but of the jobs, about 40% will be, majority of those jobs will be impacted by AI.
Yeah, and you looked at, I mean, it is somewhat intuitive. I mean, because you mentioned like building, cleaning and construction,
Right.
things that healthcare, where you actually do need a person to be tending to something.
Yeah.
Farming, obviously, is not going to have as much exposure. Uh, Office administration staff looks really,
Yeah.
that
That's
doesn't look
correct.
like a good future.
You know what's interesting is some of these things, like take healthcare, AI can actually um, both lower costs and increase costs. And the reason why is on some things like reading scans or doing diagnostics, AI can be really beneficial. I use the TSA analogy. You go to the airport, If they didn't have those fancy scanners and so forth, they would need a lot more people to be looking through your bags and so forth. So there's going to be potentially some good value there in healthcare. On the other hand, AI is going to actually help you figure out more therapies, more personalized medicine. A Nobel Prize, given for AI essentially was for that type of experimentation. And so genetics and all that could be dramatically improved with AI, but that's also going to mean higher costs. It's not going to lower the cost of existing therapies. And so I think there's potential here, just that, people need to all put it into perspective.
What are you assuming about the trend growth? I mean, how quickly does this stuff get assimilated into the economy?
Yeah, it's a great question. So there's multiple ways we've looked at this. Some, if we've looked at different forecast models of including our own of, adoption of technology and so forth. But really, if it turns out historically, if you look at other big innovations in the digital economy, the adoption of the personal computer, the adoption of the smartphone, the internet, cloud computing, and so forth, they follow a quite remarkable consistent trend in the workplace. Now, outside the workplace, the adoption rates differ a little bit, but inside the workplace, they follow a remarkable similar trend. And so we've have looked at those historic estimates as well and say, if AI, there's reasons why AI adoption could be faster or slower, depends on the area. But even if they follow the historic trend of those new technologies, or they follow, our own internal kind of model of what we think the adoption will be. They all kind of paint the same picture about what we think is going to happen. And the adoption rate, we say, is, it's going to take a good decade still before, the adoption rate is replacing like 40%-ish of the at work type of duties and so forth. So we do think it's going to be in a very similar vein to something like it's gonna be faster in some ways than the personal computer, potentially a little bit slower than some of the cloud computing, but nonetheless it will even if you just use all those the most optimistic adoption, you can pretty much put an upper bound what you think the impact will be on productivity.
And does it result in a burst and then a leveling off at a higher level permanently, or
It does,
come back
yeah.
down?
So because you can't go above 100% in many occupations like farming. And by the way, farming is greatly impacted by AI because of how you plant seeds, the soil testing, all that is very technology driven now. That's one reason why fields are so productive relative to the past. And yeah, a lot of that was machine learning models. We put that all in the same bucket, which is not quite correct, but nonetheless, there's some impact there, but still there's an upper bound in some of those occupations. And so you tend to get what economists call kind of turnpike, type results, the turnpike theorem, where you see pretty quick adoption and eventually it has to level off simply because there's an upper bound.
And so what is the boost that we're talking about here for productivity and
Yeah.
GDP growth in general?
Right. And so right now we're looking at the main type of AI that people are familiar with this, the generative AI, which is really this, one token ahead, type prediction type models. And so loosely speaking, as a lot of how the large language models work is they literally are just doing a statistical model of saying what is the best guess for the next word. And that's why sometimes they have to go back and fix what their output and so forth. And so for that type of AI, because that's the AI that we're all familiar with, the newer types of AI are still being developed and so forth, reinforced learning and so forth. But for the type of AI that is very prevalent right now, we're saying it's going to increase productivity and GDP by about 1.5% in 10 years by 2035, by nearly 3% in 2055, and about a little less than 4% by 2075. So these numbers are actually larger than, say, what Daron Acemoglu at MIT, recent Nobel Prize winner, an expert in economic growth. His numbers are smaller than that. I mean, it's a different framing of what he looked at, less on TFP growth and things like that. But nonetheless, they're smaller than that. But they're larger than his numbers, but they're clearly smaller than some of the cheerleading that you hear out there of AI enthusiasts.
I want to get back to those AI enthusiasts as we turn to consider the effect on the federal budget. And we're going to have to take our first break. You're listening to Facing the Future. I'm your host, Bob Bixby, and I'm talking with Kent Smetters, Faculty Director of the Penn-Wharton Budget Model, about the impact of generative AI on the economy and the budget. We'll be right back after these short messages. Welcome back to Facing the Future. I'm your host, Bob Bixby, and I'm talking with Kent Smetters of the Penn-Wharton Budget Model. He's the faculty director there. And we've been talking about the economic and budgetary effects of generative AI. We were talking about it was going to have a positive effect on productivity and hence on the economy. Let's put that in some sort of perspective, because I hear, given the nature of my work, that people sometimes say, well, you don't need to worry so much about the federal budget as we thought we would, and unsustainable budget deficits, because the productivity boost from AI is going to be so buoyant that it's going to really maybe not erase all that, but certainly cut it down. You did some very preliminary work on the effect on the federal budget. What did you find?
Yeah. So let me put this somewhat in the context before uh, diminish some people's parade on all this. I have been this AI enthusiast for quite a long time. In fact, I've been using GPU computing long before people heard of NVIDIA. That I was using as one of the first users of NVIDIA GPUs. Almost 20 years ago. It turned out it did not solve the problem. The threads were not powerful enough, but they literally sent me what's called SDKs with courier font bitmap notes that had some handwriting on the side. That's how early this stuff was. And so the idea of parallel processing using neural networks, we use that, been using that for close to a decade now. Very much, fanboy of all of that stuff, but we have to now put it into a rational budget type framework. And this part is very early, as you said, but our first pass at this is that the AI dividend, if you will, on the federal budget will be about $400 billion over 10 years. And the reason why we want to refine that more is that we want to take a little bit more look at particular areas. Healthcare will be transformed a bit by AI. We want to, on one hand, you can't completely get rid of the doctors and the nurses, but we're going through this great transformation of both the supplies getting smaller of healthcare providers as they go into retirement, and the demand is going up at the same time. And so AI is going to help with some of that. But we want to look at healthcare a bit more, and we want to look at some other areas a bit more. But roughly our first cut at this is about $400 billion over 10 years. So it's well short of, say, the recent tax bill costs. And we also posted this on the same day of how much the government essentially overpaid with the employee retention credit, the old COVID program. They overpaid roughly about $300 billion on that. So we pretty much already spent the AI dividend just on that overpayment of those programs. By overpayment here, I mean it's technically legal, but it's done. Most of the payments are done well after COVID. It's just it was not a program that was well designed to focus on incentives and so forth. And so I think it is, once we put it all into balance, the AI dividend is much, much smaller than what some of the op-eds that you've been hearing, reading about. I won't name names, but several months ago, the Wall Street Journal had one particular op-ed, not by the editorial board, by I guess, author who claimed that, hey, AI is going to solve the federal budget, and that's just completely wrong.
Yeah, I always get a little bit instinctively wary when I hear about magic bullet
Oh yeah,
solutions, and that doesn't mean, like you said. I mean, this is a great thing.
yeah, yeah, absolutely.
It's terrific, but we don't need to make it into something that it isn't.
In fact, you know, if our numbers, suppose you doubled or tripled the productivity growth, it's still not going to solve the budget problem. And what
Yeah.
people get is that, but when sometimes in the back of their mind, they're thinking, well, the tax base is going to get so much bigger, so you're going to get a lot more tax revenue. But keep in mind, most spending by the federal government is still on wages. And those wages, you know, they're going to be keeping up with the rest of wages in the economy too. So you can't just have like the wage tax base is somehow growing, but the spending side is not growing with growth. In fact, Social Security, the initial benefit calculations explicitly tied to economic growth, wage growth during your during your lifetime, during your working age. Healthcare spending grows faster than economic growth. And then discretionary spending keeps up with economic growth as well. So even if our number, you tripled our numbers, it's still not going to have a sizable, it'll have some impact, but not a sizable impact because you have to take into account the spending side as well.
On the other side, you get people saying that AI is going to, it's going to throw people out of work. It's going
Yeah.
to, shrink the workforce. It's going to increase income inequality. Did you look at those aspects as well?
Yeah, so we don't have a full income inequality measure yet. It's something that's still very much a work in progress. But if you just look at the occupations that are going to be hit, you can clearly see it's a mixture of everything from office administrative support. They're the highest on the list, that tends to be lower income. And so, yes, they will be hit hard. But then you look at business and financial operations, that tends to be the opposite, higher income, computer and mathematical occupations, that higher income. And those are pretty high in the list of targets of opportunity for AI. And so it's not this rhetoric that it's all going to be about, harming low income people. No, actually, a lot of low income people, farming, fishing, construction, building, grounds maintenance, production occupations, those were all very low in the list of impact on AI. I keep on telling people, college, not everybody has to go to college. The trades are
Yeah.
incredible occupations right now. I have relatives who went in the trades and they're doing really well. And because if you're a welder, you're going to get good money in Pennsylvania right now because there are so many shops that are looking for good welders right now. And so I think it's going to be a mixture. But here's what I would tell people. Yes, there will be a transition. I remember, years ago, you remember this too. There used to be secretary pools, right? Before, WordPerfect and later Word and so forth came around. And yes, the innovation of software essentially put those secretary pools out of business. But instead, they have other jobs. It's not like they just become idle people. And yes, there has to be some retraining. There has to be emphasis on education and so forth. But typically, it leads to higher wages over time. People do get jobs. They're not just sitting idle.
When I was in high school, my uncle gave me some advice. He said, work with your hands. And
Not
I
bad
think he was
advice.
probably, that was,
Yeah.
retrospect, that was probably, I didn't listen to him, but if I were growing up today, if I had a nephew, that's what I think maybe that's good advice.
Yeah.
Um, okay, so we may have to take a break in the middle of this, but one group of optimists about AI tend to be, well, there's some talk that Wall Street is doing very well.
Yeah.
The bond market isn't reacting quite as bad to the deficits as you might think because they're sort of pricing in a productivity boom from AI. Do you think they're being overly optimistic?
Yeah, it's one of the hardest things for economists to communicate is how bond markets react to deficits. And I've come to learn the reason why is because most economists don't understand it. And it's much more in the weeds, unfortunately. Bond markets are very different than equity markets. Bond markets, bond traders actually want competition. They actually want to know there are other bond buyers out there. And the reason why is that how bond markets actually work is, yes, they do. There's what we call one equilibrium, where bond traders are saying, yep, higher deficits, that's not a good thing. Future government debt is going to have to be sold at a discount, producing a higher yield. So we should essentially backward induct and price that in today. And so you get this kind of smoother relationship between deficits and interest rates. And by the way, that relationship does exist. People say, well, interest rates aren't crazy today. No, they're not taking into account that we have this enormous capital glut right now with so many people going into retirement. Mortgage rates should be basically where they're at pre-COVID. We actually have higher interest rates, probably a couple hundred basis points higher than they would otherwise have been without federal deficits, just because we have so much capital right now per person in the world. And so IMF and everybody else who was forecasting this low interest rates pre-COVID that last for until the demographic transition was going to change in a lot, well into the 2030s. And we are forecasting at least at the 2035 pretty low interest rates and so forth. And that's because of the enormous amount of capital. And then things really change dramatically at that point where the deficits and demographics are all working in the wrong direction and really pushing up those interest rates. But that's not the biggest worry. The biggest worry is the second equilibrium, which does not exist in equity markets. And that is where bond markets stop believing that the government's going to repay, or they're going to repay in real purchasing power terms, that instead the debt's going to get repaid with monetization. This is the Liz Truss moment that you saw in the UK. And so it's that flip, it's that run, it's that bank run problem that exists with bond markets. That's the scary part. And when that happens, it's not like you can say, oh, okay, we'll do something about it now. What you have to do at that point is much more painful than solving the problem today. So in fact, bond markets our deficits right now and our interest rates right now, the bond markets has a higher premium and a risk return requirement on U.S. debt than it does for Italian debt, which is crazy when you think about that. I mean, we're only 50 basis points, 60 basis points on the 10-year level and 60, 70 basis points at a 30-year bond than the UK, which went to the Liz Truss moment only a couple of years ago. So it's not like our interest rates are low. They should be much lower than they are, and they would be if we had our federal deficits, and mortgage rates would be a lot lower if we had our federal deficits under control.
We're going to have to take our second break, and then when we come back, we'll talk a little bit about potential solutions to all this. You're listening to Facing the Future. I'm your host, Bob Bixby, and I'm talking with Dr. Kent Smetters, Faculty Director of the Penn-Wharton Budget Model. We'll be right back after these short messages. Welcome back to Facing the Future. I'm your host, Bob Bixby, and I'm talking with Dr. Kent Smetters, Faculty Director of the Penn-Wharton Budget Model at the Wharton School of the University of Pennsylvania. And we've been talking about generative AI, and we've been talking a little bit about market reactions to the debt. What we're going to talk about now is solutions. And this is the good thing about the Penn-Wharton budget model, is that they don't just talk about gloom and doom statistics. What they also focus on is looking at potential solutions. Sometimes they will score things that have been proposed by others. And in this case, they produced principles-based illustrative models of tax and spending options that would help grow the economy and at the same time be good for the budget. Kent, why don't you, I mean, you put out this report late last year. It's got 13 major proposals in it. And before we sort of go through some of them, why did you put these particular packages together? I mean, what was the kind of the driving force behind I don't know, thought process behind these?
Yeah, absolutely. So here was the challenge given to us by policymakers. I mean, a lot of our work is with policymakers, behind the scenes. We get requests from both sides of the aisle looking for analysis. In fact, the whole reason why Penn-Wharton Budget Model exists is because policymakers had told me a decade ago, is that they want analysis while they're actually writing the legislation, not after it's already been written. And what the challenge was, listen, okay, you're telling us, this policymaker talking to me saying, yes, debt is increasing. We know that's not a good thing relative to the size of the economy. And so then, but what could you possibly do about it that doesn't either kill the economy, kill low-income people, or make them sicker or poorer, things like that? Is there actually a way we could solve all three things, bring down debt, not kill the economy, or not hurt and harm or lower income people? Because it seems like, people look at Greece and they say, well, that required austerity. It required some pain, even though they turned the corner. They look at Argentina, that required some pain, even though they've started to turn the corner. And so that was the challenge. That was the backdrop. And also, somebody who's been really help us over the years, give us some feedback and thoughts and so forth. Mark Rowan, CEO of Apollo, he also gave me the similar challenge and say, you really start to think through, and also gave me some great ideas and feedback, especially on some of the having immigrants, for example, be required to pay for healthcare, which is an incredible insight that had big impacts. And so that was a challenge. And the question is, could we do it? And no one's actually put together this type of large reform package. And we call it illustrative because we don't advocate for anything. We're just simply trying to show the possibilities here. And so the idea is that these large, 13 different tax and spending programs, each one of those are broken down into their own tree of many things. Yes, we could analyze each one of those separately and just add up the results, but that would be incredibly misleading, because when you change like incentives to work and so forth, it just doesn't change federal income taxes. It also changes Social Security and vice versa. It changes incentives to save for retirement. It changes not just Social Security, it changes the federal income taxes and benefits as well. And so all these things had to be solved together. And so it's a combination of a lot of tax reforms. And so early on, we get some more revenue. But then later on, we get some more spending controls that includes, for example, the retirement ages in Medicare and Social Security. We don't have to increase them immediately, but at least a couple of decades from now, they should continue to grow. I mean, it's impossible to have people living beyond age 100 and retiring at age 62. And so eventually that has to change. And so even if you're not doing anything that impact people below age, or I should say above age 50 today, people below age 50, they probably should be retiring another month later than they otherwise would be thinking of. So it's these combinations of those things. And the idea is, let's forget about how we got here and then actually come back to first principles in public economics. Why does the government tax? How do we get tax revenue efficiently? Why does the government spend? What are the corrections it's trying to make? Coming back to those first principles and redesigning a system like that. And yes, it is a very large change. I call it the Tax Reform Act of 1986 times 2 in terms of proportion. It's very significant. But nonetheless, we're able to dramatically lower the debt GDP growth, and so much so that we can create stabilization. We're no longer on an explosive path. We're able to grow the economy substantially at the same time and reduce old age poverty and healthcare premiums, and therefore increase healthcare coverage. So much so that for example, over the next 30 years, we reduce federal budget deficits by almost 40%. We grow the capital stock by 31%, wages by almost 7%, reduce healthcare premiums by 27%. And so it's one of those things. You mentioned Magic Bullet earlier. These results seem so big. We've never seen anything like this before. But these seem so big, it seemed like impossible. So we actually finished these almost a year ago, and we spent about 4 months going through our gigabytes of data that came out of this model, trying to understand validate every part of it, really understand the interactions. Their interaction effects between these programs are really big. And so, and then we released it, about 6 months ago, a little bit more than that. And then, yes, it just shows that there are possibilities here for really taming the budget deficit issue while actually growing the economy, not killing the economy, and actually reducing poverty, not increasing it.
Well, you did a number of things with the tax code that to try to rationalize it and remove distortions and that sort of thing. So, for example, you disallowed all itemized deductions except charitable contributions,
Yes,
and you at the same time you lowered the top income tax rate to 28%, and you also uh, taxed capital gains and dividends at ordinary rates.
right.
And there's a technical thing about expanding
Yeah,
the tax base to
that's
cover
right.
all pass-through income, which might, unless you're an accountant, be kind of, you're not sure what you're talking about there. But that was a big part of it. I mean, that
That's
was
right.
a big revenue increase in your plan.
Right. There's one thing economists across the political spectrum actually agree on, believe it or not. So if you look at, George Stiglitz, a Nobel Prize winner in economics, very much liberal economist. Look at Harvey Rosen, who's a conservative at Princeton. They both have books on public economics for, undergraduate students who are doing economics. And everybody agrees, including those two authors, that the best way of getting tax revenue is to actually have a broad base, very large base with lower tax rates versus a narrow base with high tax rates. And the narrow base with high tax rates will actually cause substantially more distortions than just having a very broad tax base that people can't wiggle their way out of. But then you keep the rates much lower. And so that is a very much general principle here. So what happens is that we actually do an amazing amount of redistribution through the tax code. People will say, well, the US doesn't have a lot of tax revenue. And that's actually true. We're much lower than other countries. And one reason why is because we do so much redistribution through the tax code itself. That was always kind of the Republican clickbait in the past. Like, how do you get the Republicans to agree with redistribution? Just pack it into the tax code and call it a tax cut. And so as a result of that, for example, I'll tell you, you've heard, of, your AGI, your adjusted gross income, and that everybody sees that, oh, that's like the starting point. No, that A term, that adjusted, that itself is $5 trillion of lost revenue for the federal government over 10 years just for the healthcare deduction, another 1.3 trillion for the mortgage deduction, and then put in the retirement plans as well. That all goes in just into the A part before we even talk about AGI. And so there are so many different tax breaks and reductions and redistribution that's done that way. And economists just don't agree with that. Instead, what we do is we say, we got this incredible, leviathan of different types of programs and so forth. You can actually help low-income people more just with a simple, refundable, partially refundable tax credit, which is basically the earned income tax credit with a twist on it. And basically just by family size, and obviously it's indexed to income, and that will actually achieve your redistribution goals more effectively than this labyrinth of jillion different programs. And but then it also gets rid of all these weird kinks and incentives. There's really high marginal tax rates along the way and so forth. And it really simplifies things as well. And then it helps these lower tax rates also help encourage economic growth. So not everybody's gonna be better off, but vast majority of people are better off with this.
We're going to have to take another break, and you're listening to Facing the Future. I'm your host, Bob Bixby, and I'm talking with Dr. Kent Smetters of the Penn-Wharton Budget Model about some solutions to our long-term fiscal issues. When we come back, we'll talk about Social Security, healthcare, and immigration. We'll be right back after these short messages. Welcome back to Facing the Future. I'm your host, Bob Bixby, and I'm talking with Dr. Kent Smetters, Faculty Director at the Penn-Wharton Budget Model. We've been talking about some illustrative tax and spending packages that Penn-Wharton Budget Model put together that would help reduce the budget deficit and grow the economy and have a positive impact on healthcare costs and also Social Security. Now, one of the I wanted to, in our final segment here, talk about your recommendations on immigration, healthcare, and Social Security. And I want to begin with the immigration because it's very innovative. And I just wanted to let you describe what your package was on that subject.
Sure. Right now, if we look at kind of baseline, I mean, the United States is obviously getting older. We have about 3 workers per retiree. A couple of decades ago, that was 5 workers per retiree. And over the next half century, that's going to lower to 2 workers per retiree. And we're at this point now where the United States without immigration is actually going to get smaller, where our fertility rate has dropped below the magic 2.1 children per female. And so as a result of that, we are going to become smaller as a country, except for immigration. And so everybody understands that immigration is going to be important going forward. We're talking about legal immigration, not undocumented workers. That's a separate topic. So the question becomes, given that we also have other work that says no, we can even distinguish by type of immigrant, STEM and high skilled science and technology immigrant versus broad-based immigration. But even if right now we look at broad-based immigration and not even try to tilt it toward talent and so forth, it still can play a big role in helping with the federal budget. And one way it can do that, not only does it have a higher, it makes our tax base bigger, that allows for a higher amount of wage taxes to be paid, but also the idea here would be the cost of admission for immigration is that immigrants have to prove that they actually have health care. They have to buy health care inside the United States from a certified provider. And so that would not be optional. That would be, call it a mandate. Not everybody likes mandates with healthcare, but we're talking about just for immigrants here. And so we're talking about just for, as essentially the cost of admission. And the idea is that would kind of undermine this argument that they're just coming in and sucking off the healthcare system and so forth, which is empirically is not true to begin with. But secondly, this would resolve any concerns about that. And it turns out having immigrants pay for their own healthcare actually has pretty important impacts on the rest of us, the native-born workers who also buy healthcare. And the reason why is that immigrants tend to be younger, they tend to be healthier, and so they actually improve the risk pool, but they're actually paying not at their risk-adjusted rate, they're paying at the average premium rate, like in normal group insurance and so forth. And so they would be greatly subsidizing the rest of us, and they would essentially reduce healthcare premiums by almost 27%. If we required that they buy health insurance as they enter the country. And so I think it really, and by the way, that was what I was alluding to earlier, an idea Mark Rowan had given us, gave us some feedback on this. And that was a really a genius input, because it really had a big impact on healthcare premiums and helping grow the economy.
Are the two goals somewhat in contention with one another? In other words, if that condition is put on, does it restrict the number of people that could come into the country?
It could, but it could potentially also restrict it in not such a bad way. And in particular, you could imagine that it's selecting on higher productive people, and so that's not necessarily a bad thing. People who can actually afford to pay it, but you could imagine still having like temporary workers. Especially for farming, having a separate program that basically says you're here for 3 months, 6 months of the year, and they can easily go back and forth to Mexico or wherever they're coming from for that type of work. And you could even imagine it having maybe a cheaper health program for them. But even putting that aside, having an immigration system that selects a bit on ability to pay for that, it's not bad for the U.S. economy for sure to have that selection criteria. And so, and this is really still just broad base. If you tilt it even more towards STEM and higher talent and so forth, then you get even bigger effects. But we're saying you only need to, that's just kind of gravy on top. You don't even need to do that in order to get still pretty big effects on health insurance.
And could that be paid by an employer? I mean, if I were
It could.
immigrating and I had a job coming in and I had health insurance and the job, that would satisfy the requirement.
That's right. And so how, we didn't worry so much exactly what the implementation details would be, whether it is like, for example, even though we all know the ACA premium tax that is required if in fact we don't have health insurance, we're supposed to, that tax, that penalty has been zeroed out by the Tax Cuts and Jobs Act of 2017. You and I still have to file that form, as it turns out. They zeroed out the tax, but not the requirement to file that form. That proves that we have healthcare insurance. So,
Confuses the heck out of me every year when I get that.
oh yes, and I've actually got somehow 1 year my CPA forgot to file, or I forgot what happened. I got yelled at for not following the form, which has no penalty associated with it. And so I think it is. You could use that system, but more importantly, it probably does make sense to have the reporting by the employer. There's already cheap mechanisms in place for that.
Let's turn to Social Security. One of the biggest, I guess, the biggest reform that you've got there is phase in a flattening of the benefit.
Yeah.
Explain how would that work?
Yeah, and this would be very slow. I mean, we know Social Security and Medicare in particular are very sensitive issues, and you can't just go whole hog too quickly with that. And so the idea would be really a couple reforms there. One, we would have to continue to increase the retirement age. It's already going up to age 67. But we can't stop there. Because the rate at which people are improving their lifespan, the rate at which people are continuing to live for longer, the life expectancy is continuing to improve over time. We're going to have to continue to increase that eventually. And so why not be explicit with that? And so what we say is you increase that from 67 to 70, but only starting, in the year 2037. So quite a bit delayed from now. And even then, very slowly over time. So you're not hitting anybody who's 50 years or older today. But then the part of that during that same period of 2037 to 2056, again, very slow phase in, is slowly change Social Security from this idea of it being just a pure retirement program to pretty much a poverty relief program. Let's keep people out of poverty, but that doesn't mean that we have to have, large benefits to higher income people over time either. And so the idea is that people who are on the lower end of this income spectrum, they're going to get a bigger benefit. People who are in the higher end will get, in fact, a smaller benefit. But at the same time, that is far into the future, and they have plenty of time to respond to that by actually saving a bit more in their own personal income accounts. And they're also going to benefit during their working years from some of these lower tax rates as well. And so I'm not going to claim everybody's a winner here, but most people are better off. under this approach. So it's easy to attack one part of a plan, but when you look at the entire package, that higher income people, yes, they're not going to get as big of a Social Security benefit someday, but they're also going to get lower tax rates during their working ages, and they can use that money to save for their own retirement. Put all those things into balance and notice that this is slowly, it doesn't even start for 12 years, and it slowly phases in over another 20 some years, that you're talking about plenty of time for people to respond and save.
Yeah, and I think that a good caveat there, a good warning piece of advice that you had is look at all these things together as a package, and not look at them individually, because they're meant to go together as a package, and as a package have a positive economic effect and a positive effect on the budget, which we would all benefit from, because right now we're in a low growth scenario over the future, and we have a unsustainable fiscal outlook over the future. So the more we can focus on solutions to come up with better outcomes, the better. And the sooner we can get about enacting things like that, the better. It doesn't look like anything great. Right now, we're just trying to avoid shutting down the government.
Right.
But these are really important concepts that you put on the table. And I hope people will look at them and think about how they affect the challenges that we face. I think that we're going to have to end it there. Kent, I really, I'll have to have you back to talk about some of the Medicare reforms that you had, but I really appreciate you taking the time to be with us this morning.
Absolutely. I appreciate the opportunity, Bob.
You've been listening to Facing the Future. I'm your host, Bob Bixby, and I have been talking with Dr. Kent Smetters, Faculty Director of the Penn-Wharton Budget Model. I'll be back next week with another edition of Facing the Future.